Hello, everyone. Welcome to part 2 of our lecture on Chapter 2, the assessment process. In part 1 of our lecture on Chapter 2, we talked about different types of assessment and we overviewed the assessment process, leaving off on the 4 major processes within the assessment. And that's where we are going to start off with on this part of the lecture, starting with text selection. One of the first things that you have to do as a counselor is select the test that you want to use to assess your client. And if at all possible, your client should actively participate in the selection of the tests that they will be using in counseling. By having the client participate in the decision making of which tests to use, you are allowing the client to increase the acceptance of their test results and the interpretation of them. If a client knows what they're being assessed for and why they're being assessed for it, they're less likely to have defensiveness and they're more likely to be objective in their perception of the test results when they get them. You're also increasing your client's autonomy by having them involved in the assessment selection process because you're helping move them away from an over-reliance on you as the counselor and letting them be an active participant in test selection. It is also important to keep in mind that many individuals will approach tests with some amount of anxiety, especially if the test is more intelligence or achievement based and the individual has a fear of failing the test. To reduce the threatening aspects of tests that creates that anxiety, you as the assessor should make clear to clients that the purpose of testing is to provide self-understanding, not evaluation or judgment. It's really important to convey to clients the feeling that they will be accepted regardless and whether or not they perform well or whatever the results happen to be. That you as their counselor and as their assessor still accept them for who they are. It's also important to keep in mind that even though you want clients to be involved in the test selection process, clients are not typically involved in the specific test selection, but rather they tend to be involved in the broad topic of the selection. So as a counselor, you might present to your clients, say, we have these personality assessments. Personality assessments range in variety. I have one that looks specifically at the ways that your personality is helping your current social interactions. I have another assessment that looks at the ways that your personality is harming your social interactions. And by presenting that information to the client, you let the client select which broad type of assessment they want to use. And then as the counselor, you go in and specifically select which specific test you want to administer based on the client's responses. Part of the test selection process is going to involve you as a counselor assessing different sources of information. And broadly, as the counselor selecting a test, you want to consider a test's reliability, the validity of the test, the normative data or the data that this test was normed on, the people that it was normed on, and the practicality for its intended purpose. So you might have to ask yourself, does this test possess sufficient reliability and validity to answer the questions posed by the client and the situation that they're presenting? Does this test provide appropriate normative data for my client's identities? Is this test easy to administer and score? How expensive is this test? Is the reading level appropriate for my client's skills? And is this assessment procedure culturally appropriate for my client? And all of that information is going to help you narrow down very specifically what assessments you want to do. But if you're new to the assessment process, you might be asking yourself, well, how do I find out about assessments? And there are a few different sources of information that are used to find additional information about assessments. And those include the Mental Measurements Yearbook, which is a publication that goes out and says all of the new assessments that have been introduced or any assessments that have been revised since the last publication of the MMY, or the Mental Measurements Yearbook. And the Mental Measurements Yearbook will have a critique or a review of each assessment that's included. But the caveat to the Mental Measurements Yearbook is that it only includes new assessments and assessments that have been revised. So if you're looking for a previous assessment or test, you might have to go through previous editions of the MMY. A couple of other options that come to mind are tests in print, tests and test critiques, which also will provide a source of information about assessments, but it's important to keep in mind that tests in print does not provide a review of assessments, but rather just list exactly in order by category alphabetically what assessments are in print today. And you can also rely on counseling related journals. You can go through research articles and see what tests have been supported and what tests are being used in research and counseling. I will say as well that if you are working for an agency, a lot of times you are going to be finding assessments through your agency. Because once you find a specific assessment, the way that you access it is by contacting the publishing company of that test or the author of that test to obtain a specific commercially published assessment that you can then use. And I say that you probably have to go through your agency because a lot of times the test publishers and authors want to work with agencies, and as an agency, you have a license or a discount to use a specific assessment publishing company's resources. So, as a clinician and as a counselor, you might be limited in the assessments that you can select based on what your agency can afford, what your client can afford based on their cost of the assessment, and even just what is accessible in your community. Sometimes none of those are options, and you have to use open source material. So, assessments that are completely free and can be used by anyone, which can be beneficial in that they don't cost money, but they can also be harmful in that they're widely used and the client might already have experience with them and they might not go into as much depth as you need them to. So, once you've selected a test, the next step of the assessment process is the test administration. And counselors who administer any assessment test must be familiar with the instructions and other aspects of the administration of that test. This knowledge is necessary for administering a test because tests vary greatly from one to the other on how they need to be administered. And as the assessor, it's your responsibility to make sure that you are assessing someone in a standardized format so that you're doing the same thing and you're abiding by the rules or instructions for that test. Tests can be administered in multiple different formats, and you can vary the format depending on your client. So, for example, a test can be administered in a paper and pencil format, or it can be based in a computer based format. Pencil and paper formats are really great for clients who are very tactile and like to work with their hands, but they can be a little bit more difficult to score because oftentimes they're scored by overlays, which we'll talk about in a little bit. But basically, what an overlay is, it's a clear sheet of paper that has print on it that says exactly what the score is supposed to be, and you lay it over top of a client's score and then you hand score it from there. You also have a little bit more flexibility with paper and pencil administration in that you can see exactly how a client is taking a test and you could take note on that. Computer-based format of assessments can be really beneficial in that they offer greater flexibility for when a test is administered. A client can take the test at home if they want, when they have time. There might be an option for them to start an assessment, leave, and come back and finish it if it's a longer assessment, which then also increases the opportunity for standardization. But there is the aspect with computer based assessments that some clients experience anxiety with having to take assessments on tests. And you want to take that into consideration before you determine how you want to administer a test to a client. Tests are also subject to error on the part of the test administrator. Specifically, we have what's called expectancy effects that can create a form of measurement error. So, one specific example of an expectancy effect is what we call stereotype threat. And this can be a factor when individuals of a minority status, such as women or someone of a racial and ethnic minority status, are instructed that a test's purpose is to assess a construct, such as math skills or intelligence, that they internalize as lacking in themselves. And when those individuals are simply in a testing environment with other people who possess positive stereotypes for that particular construct, it can create an error in measurement in how well those individuals do. And that's this expectancy effect. If you're going in having this expectation of how someone is supposed to do, how I, as a person taking the test, am expecting that I will do based on the content. We also have administrator expectancy effects that can come into play. And these are what we call the Rosenthal effect. And this is where individuals are having, as administrators, are having this preconceived idea of what they expect to find out of an assessment. They are expecting an individual to perform in a specific way, and this can create an error in measurement if the assessor is only looking for information that confirms their expectancy. If that is occurring, this is creating a measurement error. As an assessor, you have to go in as objective as possible, paying attention to all information and taking all of it into consideration. We can't just look at information that supports any expected findings that we hope for. And with that, individuals should really be informed prior to testing about any conditions that may improve their performance on aptitude or achievement tests. So, if that means telling people to take a practice test or review certain material, that can be really helpful. Also, during the test administration itself, client counselors should encourage clients to follow the instructions carefully and to perform as well as they can. If you're assessing small children, this might mean presenting the assessment as a game or as an experiment for them to try out something new, something that will allow the child to interact with the material in the best way possible so that you can get the most complete picture of their skills. And overall, the testing environment should be suitable for test administration. So you should have adequate seating, good lighting, and ventilation in the room, and it should be of an appropriate temperature. You don't want the clients to be uncomfortable while they are taking their test. But also, you want a testing environment that's free of noise, interruptions, and other distractions, because a lot of times assessment tests will have time limits. And you need to follow those time limits exactly. And if you have interruptions that come in, that can interfere with how you score things. And as a counselor, you should make sure that your clients are not cheating on the assessment. They're not working ahead or going beyond the time limits. And another important thing to keep in mind with test administration is that sometimes you're going to have to make accommodations with testing, such as providing clients with additional time or using an interpreter. And you should use those accommodations if they're going to improve the opportunity for the client to demonstrate their own abilities and not provide the client with an advantage over other test takers. So, using an informed decision to say that the client needs this accommodation in order to best represent their skills, but this is not providing them with additional skills or an undue advantage compared to other test takers. In the final stages of the assessment process is test interpretation and the communication of findings. And when you are communicating findings to a client, this can occur before a test, it can occur during test interpretation, but it should always be intentional and an integral part of the counseling process itself. Communication can occur informally, such as during a counseling interaction, or it can be more formal, such as when you write a full report, which is what you all are going to be practicing at the end of our time together through this course. But when you're also looking at test interpretation, you have to score them. And tests can be scored either by hand or they can be scored by computer. and counselors should strive to supplement either method with additional information to minimize the disadvantages of both hand scoring and computer scoring. So, tests that are scored by hand often use the scoring template or overlays that can be placed over the answer sheet to identify incorrect responses. Compared to hand scoring, computer scoring is a lot more rapid, accurate, and thorough. But the computer makes it possible for us to also undertake elaborate test scoring procedures and programs. So being able to look at the rarity of a finding, and it can do that very quickly. A test oftentimes has a very established validity for its various uses, but that does not necessarily ensure the validity of computer-based testing and computer-based scoring for that test. So, a lot of times there are scoring rules in computer based testing that are based on a trade secret that we as assessors don't know about. So, it's often difficult for us to interpret how adequately they have been developed. Also, as counselors, if we're going to use computer based testing methods, and computer based scoring methods, we have to take those results in light of other information that's been collected about our client. Computer based scoring oftentimes just takes the raw scores that our client completes and converts them into an interpretation of what that client is experiencing. And those interpretations aren't really the best use of the client's skills or the best representation of who they are. So, as a counselor, you have to use your professional judgment to take into account any individual or situational factors that could alter the scoring report that we're getting from the computer scoring for our specific client. Within testing, we also have to use well-established testing methods for a client. And the testing methods that are established for a client are oftentimes established through the International Test Commission. They establish guidelines for the best use of interpreting client information and how we should use that. So as counselors, it's our responsibility to stay up to date on the Test Commission's recommendations. We can oftentimes use test administration and test assessments to monitor client progress and to evaluate counseling outcomes. So, progress monitoring refers to the process by which counselors collect data to inform treatment planning during the counseling process. Outcome assessment oftentimes refers to the evaluation of the effectiveness of counseling at the end of the counseling relationship. So, in the context of progress monitoring, we can use both progress monitoring and evaluation counseling to inform counseling process by minimizing any risk of treatment failure, identifying when a client has or has not improved, and to make decisions regarding treatment and counseling termination. Progress monitoring specifically is also referred to as feedback enhancement therapy or response to intervention or RTI. Feedback enhanced therapy is where you take progress monitoring measures and you use that to create a feedback loop on counseling. So, taking that information to inform where counseling will go next, what you should be focusing on next, what goals you want to set, and what treatments are going to be most appropriate for that. RTI, on the other hand, serves as a specific type of progress monitoring where you identify children who may be especially vulnerable to maladaptive academic or behavioral outcomes, and then you provide those specific children with real-time interventions to address and monitor their concerns in either small group instruction or in individualized interventions. So you use this feedback progress monitoring system as a way to identify the children who are going to be at risk and then start to implement changes immediately. You can also use outcome assessments to best determine how a client is doing after a session has ended or after treatment has ended. And counselors within an agency or across the profession can collectively engage in outcome assessment to better inform their practice on a larger scale. So, determining what things are working for most of their clients and what things are not. At an individual level, both the client and the counselor can benefit from outcome assessment. Clients can profit by seeing progress in resolving issues and improvement in their own well being, where counselors can use feedback from the clients to learn what counseling approaches are most effective for their clients with different types of clients. At an agency level, outcome measures and outcome assessments can provide information on establishing and modifying counseling programs within the agency and in gaining support for those who fund the programs. And finally, as a profession, we can use outcome assessments and outcome studies to lead to more successful evidence-based treatments and strengthen the viability and credibility of the profession as a whole. When we talk about assessments, outcome assessments, we can use them at various levels. So we can use them on a particular criterion. So there might be a very specific question that we're asking our clients that we're looking at change over time. And a common one that's used is whether or not someone is experiencing suicidal ideation. So we can go in and look at, all right, when you started at therapy, you were saying yes to experiencing suicidal ideation. So on this particular question, you said yes. And now by the end of treatment, you are saying no on this particular criterion. We can also use outcome-based assessments for judging whether a baseline score has changed. So we can say, all right, I've administered this assessment to you, this assessment for depression. And when you started therapy, you were scoring in the 10s out of 15. And now at the end of assessment or at the end of our time together in counseling, you're scoring down at like 2 and 3 pretty regularly. So I'm seeing that your scores have changed over time. You can also use assessment to look at changes on a baseline score compared to a normative group. So you can look at how someone's score has changed based on what we would expect. So compared to other people who are of similar age to you and of similar identities, you have a score that's much lower than what we would expect or much higher than what we would expect. So you can use that to inform outcome-based assessments. And in terms of monitoring client assessment, there are multiple tools for assessing client progress and evaluating counseling outcomes. But overall, these processes should be brief, they should be sensitive to change, they need to be psychometrically sound, they need to be valid, they need to be reliable, and they need to be appropriate for the client and the treatment purpose. In addition to that, counselors really need to use multiple assessment methods and collect clinical data from multiple individuals to best determine what outcomes are being achieved for that client. There are 4 major tools that are used for assessing and monitoring client progress and evaluating client outcomes. And those are client satisfaction forms, client self-report scales, client self-monitoring, and rating scales. Client satisfaction forms are the ones that are going to assess the degree to which counseling fulfilled clients' expectations, so their own satisfaction with the process. Client self-report scales, on the other hand, are going to be used to evaluate changes in a client's status or functioning as perceived by that client. Client self-monitoring is commonly used as a part of homework assignments that counselors assign. So, for example, having a client pay attention to their behaviors, any negative thoughts or impulses, or instances when something positive occurs, and having them use that as an assessment and bringing that back into counseling and become part of the counseling session. And then rating scales can be used as a way for counselors to get additional information about a client. So a client can do a rating scale, but most often when we're talking about a rating scale, we're having the counselor themselves rate the client on specific outcome measures, or maybe family members or friends or teachers or spouses, coworkers, whoever it is as a trained observer that's going to be in a position to judge a client's behavior and then can report that information back to you as a counselor as a part of that assessment. So, from here, that is going to wrap up our conversation on chapter 2. And as I mentioned, at the end of each chapter, I'm going to have this in review section to give yourself some opportunities to reflect on what information you're going to want to know for the exam in this class. So, I will see you all in the next lecture.